This is the fifth video in our series, and in today's video I'll be discussing testing for acquired color blindness with the Good-Lite HRR Color Vision test. What distinguishes acquired from hereditary color blindness? There are several different characteristics of acquired, but what is known as Kollner's rule is very useful, though with some exceptions. Generally, blue-yellow or BY defects, referring to HRR types that, again, you can see on the score sheet, arise from conditions, and there are many, that affect outer layers of the retina. On the other hand, red-green or RG defects are associated with conditions that affect inner retinal layers, optic nerve anomalies, and lesions of the visual pathways. Certain drugs and exposure to toxic agents also can affect color vision. There may be changes in color vision during the course of drug therapies known to affect color vision. Hydroxychloroquine is one of them. The color defect usually is blue-yellow. It's important to remember that acquired color blindness may be slow to develop and can combine with color blindness that is inherited. Estimates are as many as 70% of ocular diseases affect color vision, and likely 80% of these are blue-yellow or BY. So, examining HRR test results, are there any misses of BY symbols or plates, 5 through 6, or plates 21 through 24? A few examples of conditions potentially affecting blue-yellow BY color vision are chronic simple glaucoma, ocular hypertension, although much more likely if it's glaucoma, pre-retinopathy diabetes, again more likely if there's retinopathy present, and retinitis pigmentosa. Now to more specifics that aid identification of acquired color defects. They usually are unilateral or asymmetric, and this indicates the need for monocular testing. Generally, again, mostly blue-yellow, and since they're acquired, we can expect the prevalences to be the same in male or female. Other measures of vision function may be affected: visual acuity, visual fields. Colors are named as seen, something that, surprisingly, is not likely if the color deficiency is hereditary. By the way, this is why one should not rely on color naming to identify hereditary color blindness. As mentioned in an earlier video, hereditary color defects are quite stable. Acquired defects vary with the underlying condition. Color vision often returns to normal with resolution of the condition. Lastly, the results generally are unambiguous with hereditary defects, whereas with acquired, the types of errors often are not clear-cut. For example, the patient may fail one test and pass another, or there may be a mixture of blue-yellow and red-green errors. In our next video, I'll be answering some of your questions. Look for instructions on the screen. Thank you for watching, and be well.